Hello, 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 everyone. How are you? Hope you're having a fantastic, fantastic day, and may peace be upon you. And welcome, welcome, welcome to the show with me, your host, Dr. Izdihar Jamil, on the It Takes Courage TV show. And today we are going to be talking about staying healthy this flu season, what really works. And I have a very special guest with me today, who is Mike, who is the owner of Growing Healthy Together and also a certified holistic pediatric nurse practitioner. And basically, like, Mike has been taking care of me and the kids since, I don't know, probably like 8 years or so, like probably like at least 8 years. So let me bring in Mike to the show, and you guys can meet the person that looks after my family. Hi, Mike. Welcome to the
Hello. Hello. Thank you. Pleasure to be here.
Thank you. How long has it been? I feel like it's been years,
Yeah,
but I was still with you
at
from
least 8.
at least 8, right? Because you were at the
Were
Long Beach
you?
location.
Yeah, so I was here in not too far away off of Bellflower on the 405 freeway, and then we moved to the office that
Hmm.
we are in now. So were you in the old office too?
Yes, I was at the
Wow.
Bellflower because I've been
Bellflower office, yeah.
at least 2015, 2016.
That's about right. Yeah.
So Mike has been taking care of my kids. I first had 2 kids, Abra and Nadra, and then now we have Rehan. And then
Hmm.
his practice also takes care of myself and my husband. So it's grown to, like, from a pediatric clinic to a family practice. And it
That's right.
is, Mike, your vision and your what you believe in is the holistic side of pediatric and family health. So let's tell us, what does holistic pediatric approach look like, especially during the flu season now, because the flu
Yeah.
season is kicking in full swing, and why is it so effective?
You're definitely seeing a lot of flu right now. A lot of other things too. So it's quite interesting. It's kind of early for us, but we're ready. Let's go. So, I mean, I think we really focus on sort of fundamental stuff, things that some people might consider obvious and maybe not. And I think if you focus this and make this part of your everyday routine and everyday life, you'll notice over time a significant change in the health and wellness of your children. So we really focus on the whole body, like the whole self, right? The mind, body, spirit, community, focusing on the core pillars of health, which are the obviously good, healthy sleep. That's a very high priority now. That used to be lower on the list, but we moved it up to the top now. So we want you to really focus on getting sleep in, and we'll talk more about that. Healthy nutrition. I can't emphasize enough how important it is to stay healthy by eating healthy foods, staying away from processed foods, eating stuff that grows out of the ground, healthy fruits and vegetables, lean proteins. Gut health, we know the whole association between the gut, the immune system, and the brain, and keeping your gut healthy, it plays a huge role in staying healthy, particularly during cold and flu season. And then stress management, we've added that to the list. It's kind of always been there in the background. We're making it a priority as well, and understanding how to have good coping mechanisms, relying on your resources, pulling in your family, particularly in those stressful moments of life. So we
Yeah, that's
know that.
a lot.
We know that the effectiveness of managing these pillars gets to the root causes of many disease processes that we're seeing nowadays. Preventative, obviously, being our number one priority.
So you're basically taking holistic is more on the looking at the root causes, right? Versus,
That's right.
okay, a kid coming in sick, okay, here's an antibiotics, and then off they go, or take a
Correct.
Motrin, and then off they go. And
That's
my
right.
with Mike, been 8 years or so, that there's always something else that he tells us to do. Like you tell us to do, okay, take vitamin C, take zinc, take selenium, and then you have lavender oil, or you have what was the lavender, peppermint, lemon? Was it like that? What you said?
That's right. That's
The
right.
essential lavender, peppermint, and lemon. Mix it
Hmm.
together. If anything else, take Vicks vapor and just rub on
Sure. Sure. Easy to get, over the counter remedies. Yeah, you hit on something that's really important to know. We are sometimes have to be reactionary because by the time we see patients in the office, they haven't been following sort of the pillars that we talked about, and we have to respond in some way. So we do then, try to fix the problem as they present. But at the wellness visits, it's super important that you attend all the scheduled wellness visits for your child. And we can go over the schedule, and I can provide it for you too later. Is to offer the educational piece that you've now learned over the years of what I can do at each of the stages as the child grows, and how I can incorporate the 5 pillars at each of the different life stages the child exhibits.
Mm-hmm. Yeah, and you touched something about processed food, which is as soon as you go into like a supermarket or Vons or wherever, that's the first thing that hits you, right?
That's right.
With the
Yeah.
with chips, with the cereal, and all those things like hitting granola bar, like granola bar maybe half, but it's also loaded with sugar. So can you talk about how this processed food is affecting the health, and as a result, lower the immune system, and as a result, they're more susceptible to flu?
That's right. So if you are eating foods that are food deserts, right? So we talk about food deserts in a community where there's no good access to the healthy food choices. The same applies to the actual individual food itself. So if there are no nutrients in there to support your immune system, to support gut health, to support your brain function, then there's no benefit to it. It's monolithic. You're not getting any nutrition out of that food. And so it's filling a calorie need maybe, and filling a habit need. Maybe you want to have that habit, that salty, sweet, crunchy food, but it's not giving you the nutrients you need to stay healthy, and your body lacks that, and then you get sick, and that's the whole problem. And not only that, there's also data to show that a lot of the nutrients or the ingredients that they use in these processed foods are toxic to your body. And so your body's busy trying to fight off these toxins that you're providing it, and it doesn't have enough resources available to fight off illness and disease.
Mm-hmm. Yeah, and I noticed as well that, whenever we consume processed food, let's say a bag of chips,
Yeah.
like we tend to eat more of it because it's
Mm-hmm.
not filling. So
That's it.
instead of like a few pieces of chip, you finish the whole bag in
Yeah.
one go, and then you grab
Yeah.
again. So it's not really filling in the long run as compared
Yeah.
to having like potatoes and steak and
That's
vegetables.
right.
Even like a small portion fills you in. So that's one part of the nutrition that we talked about, is
Mm-hmm.
the 5 pillars is going to help combat the flu, and in the long run, like Mike, like the longevity of things, like you stay healthier longer, and if you do come up with a flu or something, that it's quicker. So let's talk about the next pillar, which is sleep. What tips can you give the
Yes.
audience?
As parents, we know sleep is a challenge, particularly at all age groups, right? Doesn't matter. Infants are tough, because they're waking up every hour to eat, every couple hours to eat. As they get older, teething kicks in, developmental stages, they go through broken sleep cycles. So recognizing that you're providing an environment that's safe for the kid to sleep in. The kid is cold. Cold environments are helpful. Dark environments are helpful. Obviously, quiet as best you can. Having scheduled busy days so that way the kid is occupied, consuming energy, which makes you tired and supports sleep. Having a really tight schedule, even on the weekends, for sleep. So if you're waking up at 6 in the morning and going to bed at 8 or 9 at night, continue that over the weekend too, because that keeps the sleep cycle going and allows you to have complete and thorough sleep. We know that just a single night of poor sleep increases your natural killer cells in your body, which then is a competition against keeping yourself healthy. So your body's busy trying to fight off the killer cells that are ruining your ability to metabolize correctly, and doesn't have the resources available to keep you from preventing disease.
So that's why we see when kids are sick, like they tend to sleep longer, right? And because it's
That's
kind of
trying to
like
get rest. Yeah.
resting, the body needs the rest. And I've also read somewhere on a research that says that if you have like quality sleep, it just helps with the weight loss. I know we're nearing the new year. One of the number one goals of people is to lose weight and everything.
Yeah.
I've read somewhere that because the body, like you were saying, metabolizes the energy better, it just helps with a lot of things and the quality of sleep. So we've covered a little bit of nutrition, processed food, and sleep. And what would be the next pillar that we can expand on?
Well, we want you to get around and move around. So activity. We want you to stay active, getting some sunlight. We know there's vitamin D in the sunlight. There's fresh air going outside. Moving your body around allows those free radicals to get loose, and then your body can then trap them and then dispose of them through the kidneys and the gut. And so we want you to stay active and spending time outdoors, even if it's cold, even if you got a little bit of a cold or you're sick. Getting outside, getting some sunlight, breathing some fresh air is going to help.
What would you say to parents who have creative kids? Those kids who do not want to do sports, they're more creative, they love arts, they love drawing, they love, making things at home. So what would you say to the parents that's going to help those kids to be a bit more creative, a bit more active?
I've had a couple kids like that, and it's important to include activity within the creativeness and the art that they're expressing. So, for example, if you have a drawer in your family, loves to draw, loves art, loves paints, loves to create, make a visit to the museum a routine. Go to the Natural History Museum here in LA or wherever you live. Go to here in Long Beach, there's several museums that we can go to and walk around and see the artists and see their work, and then educate the child who's the budding artist, right? Trying to be that artist that as they grow up to mimic some of the styles that they've seen there. So the actual act of physically going to the museum, walking around the museum, spending time away from the home environment, getting outdoors and meeting other people is so good for your overall health that making it part of the routine is beneficial.
Okay, so like get them moving in some way, right? So like
Absolutely.
you can't make them moving like every day. Like at school, obviously they're moving in some way, but like we're talking about this additional thing, the museum or the park or
That's it.
the what do you call that? Hiking a little bit, just get that rolling a little bit, which I think is
That's another one too. I had one my child that was interested in photography, and so we would go to the Back Bay and Newport, and we would go to the peninsula and walk around and photograph birds and plants and wildlife, and that was just an opportunity for them to express their art in the same time that we're outside walking around exercising. So it's a really good combo.
Yeah, I mean, because my daughter is actually a bit more creative. Like she would not want to do any sports. Like there's some things that she do it at school for PE, but to get her to go to places is hard. But when she's there, she will be running around. She'll be like throwing stones. She'll be like doing stuff. But I think it's just like having to go through that. Like let's go. Come
Let's
on.
just go.
And I feel like at some point, if it's family time, making it like not an option. Like family time is family time.
Yeah,
Gotta go.
for sure. We did family walks. We still do. And we'll pick a spot. Somebody gets to pick a different one every week, and we'll go and walk around. And whether it's a historical site or beach site or mountain or forest or whatever, there's just an opportunity to go somewhere else. There's actually a lot of really good data that shows that walking through forested areas or where there's lots of trees, your eye movement, moving back and forth among the trees, is really good for your mental state. So just doing things like that have multiple benefits.
Brilliant. Okay, so we've covered nutrition, we've covered about movement, we've also covered about there was one thing that we covered. I remember that the next one is stress management, right? We covered about sleep, and then the fourth one is stress management.
Risk management, and then gut health. So let's not forget about that. So gut is incorporated in the nutritional piece.
Mm-hmm.
But stress is challenging for everybody. We all experience stress. We know that there's good and bad stress, and to be able to recognize first off the two, and to understand that there are strategies and coping mechanisms to be able to temper stress or have more control over stress. And it's a whole lifestyle sort of arc of strategies that we use to improve mood and behavior and stress in parents and stress in children. It all starts with, we mentioned the other pillars, and so they all relate to each other. Healthy nutrition, good sleep, active lifestyle, gut health, and it leads to overall better sleep. When we talk about gut health, providing that good, healthy nutrition, stuff that grows out of the ground, you can support the gut with probiotic use, try to avoid things that damage the gut, like dairy products, milk in particular, and drink plenty of water. I can't emphasize enough how important water is for your overall gut health. And then that translates to a healthy brain function. So as your gut stays healthy, your brain function stays healthy. We want parents to feel empowered. We want parents to have the knowledge and information to be able to care for their children confidently. And following the recommendations that we use at Growing Healthy Together, we tell you what to do to prevent cold and flu. We help you through moments when you have strategies that, and get, with sick kids, the kids who get cold and flu and vomiting and diarrhea. That's going around too. Oof, that's nasty. And that way and the kids, because they're living such a healthy lifestyle, they're doing all the things we recommend. They're sick, but they're sick for shorter periods of time. They're not really, really sick, and they're and very worrying for the parents. So that's the process of reducing stress, building confidence, knowing what you can do for your kids that's safe and healthy, and keeping them out of hospitals for sure, and hopefully out of sick visits at the clinic.
Mm-hmm. You mentioned something about milk, like not drinking milk. That's something that I've always heard, you need to drink milk for the bones and everything. So talk about, this drinking milk. If not milk, then what is it? Like oats milk or almond milk? Like, why not milk?
That's right. Let's talk a lot about that. It's not a popular theme among people in my business to say this. I'm sort of unique in that aspect, but ultimately milk is very monolithic. You have a lot of fat, you have a lot of calories, you have some calcium, some vitamin D. There's really not a lot of other nutrients in there that are helpful. In our society, honestly, do you think we need more fat for our children? No, right? No. There's plenty of healthy fat, other healthy fat choices that you can make. I'd rather a kid eat, good, healthy, lean protein, fruits and vegetables instead of drinking a glass of milk. So we'd never want milk to substitute a meal, right? The milk, for habit drinking, I drink milk to sleep. I drink milk for a nap. I drink milk for comfort. There's a white paper that was published in American Academy of Pediatrics. No, I'm sorry, American College of Surgeons, and then in 2017 that showed a link between habitual drinking of milk and childhood obesity. There was a study done prior to that looked at cardiac tissue of those kids that died for other reasons. So kids that died in car crashes, that had terrible accidents, ingestions, whatever, they died for other reasons. So they went back and looked at the tissues of the heart blood vessels, and they found early signs of atherosclerosis starting at a year of age. So we know that heart disease is complicit somehow in the child's diet. And really at that age, the only thing they're eating that has that much fat is milk. So Mike says, and again, I'm alone in the corner on this one, don't transition your kid from breastfeeding or formula to full fat cow's milk. Transition them to healthy food choices and water. And they won't know anything different at that point. They won't need to have any milk for comfort reasons if they haven't been exposed to it. If your child has already been exposed to milk and is already in that comfort mode, transitioning them to water is what's recommended. Sometimes we can bridge that transition with either drinking non-fat or low-fat milk, or one of the other milk products you mentioned.
Mhm.
I do caution folks on the nut milks, because nut milks are really just sugar water. If you look at the ingredients, there's not a whole lot of nutrition there as well. So I'd rather them just go to food and water.
Yeah.
But I get it. I love ice cream. I'm with you. I'm not going to say no to a good, healthy bowl of full fat milk ice cream. I do smoothies too, and smoothies sometimes I choose to put coconut milk or choose to put almond milk in there. I love having almond milk and oat milk in my coffee, but that's not substituting a meal. That's just adding it during the day as a putting milk in cereal, for example. Feel free, but if you're, as long as you're not drinking a glass of milk and you're not eating a meal as a substitute, then you should be okay.
Yeah, okay, perfect. So, I mean, I've heard a couple of health practitioners as well mentioning about milk, because it's not easy to digest, the cow's milk. So that
That's
was
right.
one of the things that, kind of like triggered me, because, like we have like, my kids have oats in the morning. So I'm like, okay, then transitioning it to like, oats milk, because like you said, it's not like the only thing they eat, right? It's just a supplemental part of a thing. So that is great to know. So and with the gut health you mentioned, because this is like one of the things that if your gut is not healthy, it just affects your immune system, your sleep, your hormones, everything else. Um, you mentioned eating food like probiotics, or probiotics yogurt, or there's when I went to your clinic, you had those probiotic yummies that in the little thing that could help as well. What are the food that parents can incorporate in their meal time to help with the gut health?
Yeah, root vegetables are really key, and putting it and creating an environment in your gut that promotes good, healthy probiotic use or good, healthy gut flora. So carrots and turnips and whatever grows under the ground, potatoes, right? You mentioned potatoes earlier. Those are really healthy choices that you can give kids if you can get them to eat them. That's the challenge, right? So how do I get my kids to eat a turnip? Make it taste good. Quite frankly, put seasonings on it that that you like in your palate, that you're learning. The kids are learning their palate as well. So season it appropriately. Just the right amount of salt, not too much. Maybe a little bit of pepper, garlic for sure. I like olive oil as my fat of choice, so I put olive oil, or you can use avocado oil. You can mix the root vegetables with other things to kind of make it more palatable and easier for the kid to take. So I think if you make it sort of that's all the kid gets and they don't know anything else, then they tend to want to eat it and they tend to enjoy it.
Yeah, that's perfect. And then I've read somewhere about kimchi as well. So like
Yeah, I was going to mention pickled things for sure. I forgot that. So pickled things, sauerkraut. I'm like, oh, how am I getting my kid to eat sauerkraut? I got lots of kids in my clinic, and the parents that's all they get every meal. They get some pickled item,
yeah.
and sauerkraut's super easy to make. You can make it at home. Just make sure that the pH is right and the temperature is right. You're not making bacteria, and yeah, the kids, if that's all they know, they tend to love it. And it
Yeah.
tastes good. I love the way that stuff tastes.
I've never had sauerkraut before, but I've had like kimchi. So
Kimchi, yeah.
yeah, so I mean, I'm open to like trying the sauerkraut, which is going to be like exciting. And my kids, some of my kids like the kimchi as well. So
That's great.
that's like a good sign. Okay, so we've talked about the 5 pillars, right? Which is like movement, sleep, stress management, nutrition, as well as gut health. Let's talk about what are some of the biggest mistakes that you see parents do during flu season, and how can they shift their routines?
Yeah, so it all focuses again on the pillars, and so they don't prioritize sleep, right? They let the kids stay up late. They themselves don't go to sleep at a decent time. They don't incorporate rest in their daily routine. Back in the day, we used to have, you'd wake up in the morning, you'd have a small breakfast, you go to work, you come home for when you could come home for lunch. This is back 100 years ago, and you would take a nap, right? Remember the nap? And then you'd wake up and you go back to work and come home, and there maybe had been a nap before dinner, and then you'd go to bed for the night. So we incorporated rest or quiet time, even if sleep isn't involved. You can have quiet time scheduled throughout the day, so that there's restful periods, and that helps.
Mhm.
Um, understanding the difference between a virus and a bacteria as well can help you be more preventative. A lot of times parents will come in and go, my kid needs an antibiotic because he's got a cold or he's got green snot coming out of his nose, when that might not be the best choice at that moment. We know, statistically speaking, that 80% of all ear infections, upper respiratory infections, throat infections are viral in origin. The root cause is a virus, and antibiotics aren't going to help for that. So we're going to help support your kid and get over it quicker through hydration, healthy food choices, and supporting the immune system with supplements. So we know you mentioned a few: zinc, vitamin D, selenium. We can use elderberry as a mucolytic. Age appropriately, we can use honey to help break up mucus. So there's lots of really good strategies we can use while, if your kid is sick, not have to use antibiotics. Obviously, if we see pus, white discharge, high fever, really sick looking kid, we know antibiotics are appropriate at that moment, and we'll prescribe as needed.
Yeah.
A lot of parents are driven by fear. There's a lot of fear-driven medicine out there. Oh my God, it's going to be the worst flu season ever. Oh my God, this is the worst thing we've ever seen. So we want to shift the mindset from a fear-based sort of parenting model when it comes to health and nutrition to a mindset of confidence and to know exactly what to do when my kid gets sick or gets a cold or gets a fever. We know fevers are very, very healthy response of an immune system. You get a fever, your body's fighting off the virus or the bacteria. Increasing the temperature slows down viral replication and improves your overall outcome. So let the kid have a little bit of a fever. But if he's super uncomfortable, high fever 103.5 or higher, or I'm sorry, 101 or 1 degrees centigrade or Fahrenheit or higher, those are all good reasons. Let me clarify. For fevers 101 degrees Fahrenheit or higher, I do recommend a fever reducer. So either Tylenol or ibuprofen or whatever fever reducer you're used to using at home. And then if it gets higher than 103.5, reaching out to your healthcare provider, reaching out to your pediatrician so that you can get advice as far as what to do. But I think those are kind of key driving forces. Key mistakes that parents make are, not supporting the sleep, forcing antibiotics on a kid who doesn't need it, and they're driven a lot by this fear mongering that's done out there. So
yeah, I mean, it's hard, as a parent, when your kid is like have that high fever, you kind of like worry. You're already not sleeping at that point. So, everything else, like your kid is clingy. You can't even go to the bathroom without, the kid crying. So it's tough as well. But you over the years, you taught me multiple tools that I can use at home. Like the garlic oil, right? So you taught me about the garlic oil, essential oil. So you were the first one to introduce me to essential oil, in the sense that I remember when I came to your clinic, you're like, oh, you can do this kind of oil. And one of the first oil that I picked up at your clinic was eucalyptus, because they say it helps with the breathing and what do you call it? Diffuse it, put it on the feet and on the foot and everything. So we mentioned a few things like selenium, zinc, elderberry syrup. Like I now make my own elderberry syrup, because if I go to Sprouts, it's going to cost me $20 every bottle. So I might as well, buy the whole thing exactly for $20 and just make a bunch of oil from it.
Make batches,
Yeah, batches. So we have zinc, selenium, vitamin D supplements, and you recommended Juice Plus as a supplement for, and they still have it. Let's talk about the essential oils that people can use, because this is something that that you've taught me over the years.
Yep. You mentioned sort of the three kind of big essential oils: lemon, lavender, and peppermint. Those are the three ones that we use for respiratory symptoms. You can also use peppermint to help reduce fever. But once you get past the 101 threshold, it's not as effective at reducing fever. Take the clothes off, blow a fan in front of the child, and then you can use the peppermint oil if the kid's old enough to apply to the skin in order to reduce the fever. You talked about garlic oil for the ears. Not an essential oil, but nonetheless an oil that we use, garlic and mullein, in the ears to help prevent ear infection. So whenever you get a kid who has clear runny nose, putting oils in the ear, garlic oil in the ear may help reduce their risk for developing an ear infection. The brand that we've become most familiar with is doTERRA. doTERRA has some proprietary blends that they use for specific reasons. So they have like a DigestZen that works really well for helping digestion. So you can rub it counterclockwise on the belly, and that can help. They have a really good one for mosquito prevention, which I hear is, we have ebbs and flows with mosquitoes, right? And so whenever we have a rainy moment in Southern California, the mosquitoes tend to congregate, and their Terra Shield is really good for reducing mosquito bites. And so I diffuse it, I spray it on my body. It's great. It comes already pre-diluted out, so you can spray it right on you.
Yeah.
Those are really key components. So we incorporate a lot of that stuff in our practice as well. Although essential oils at the time when I first started were not very popular, and the popularity has ramped up so much that now I feel most of my parents teach me about essential oils more than I teach them. So, but I think it's still sort of a foundational piece that we use in our recommendations at our clinic.
And when you mentioned doTERRA, some of the Young Living people are gonna like, no, where is Young Living?
Sorry.
Yeah,
I'm sure they're really, really good. I haven't, we've just been focused on doTERRA since I started. So, and I'm sure they have an equivalency that's comparable for sure.
Yeah, I'm sure. I've started with doTERRA and now I'm into Young Living. But what we're trying to say is that if you go for essential oil, you want to go for the quality ones, because a lot of the ones in the market, whether at Sprouts or Whole Foods, you can smell that. Take a lavender from Whole Foods or Sprouts, and then you smell it from doTERRA or Young Living. It smells it's different. The quality, the potency of it. So what I guess like what Mike trying to say is that, use a quality oil from a brand that has some reputation with purity, potency that you can track. It is going to be more expensive, right? doTERRA Young Living is going to be like maybe double or triple more expensive than what you found at Sprouts or Whole Foods. But it's very potent. It lasts longer. I feel that it's far more effective. Like if I put in my humidifier, a drop or two is good. Like the other brands, like probably have to put like
a bottle. Yeah.
Yeah, you have to put the whole bottle from it.
I also want to emphasize too, both those companies do clinical trials. They study their essential oils. They assess their efficacy and safety with children. So in my perspective, the safety aspect with children is which holds true. So if it says it's approved for a child at a particular age or a particular weight, then I know I can trust it and it'd be safe for that child.
Yeah, and one reminder that if you do use essential oil on kid, like Mike told me that you want to dilute it with an oil, whether it's coconut oil, olive oil, any carrier castor oil, or like put it like at the top of their shirt, so that like peppermint or something, you put it on their shirt so that it helps them with the breathing of it. Like Nancy, who is one of Mike's practitioner at Growing Healthy Together, and his clinic is based in Long Beach, but I believe they do offer telemedicine from it. Nancy would say, "Oh, your parent is not going to like me, but get some peppermint candy cane. It just like clears the throats, just open things up."
Totally works.
Yeah, it totally works.
It totally works. Yeah.
And okay, so let's touch base. I've got the QR code for Growing Healthy Together. You can, I believe, is it ghtkids.com, right, Mike?
That's right.
Yeah, ghtkids.com, or you can scan the QR code there to find out more.
Cool.
The in-person is in Long Beach, but Mike does telemedicine. If he's not doing telemedicine, he is doing now telemedicine because
it sort of lost favor. It was really popular, obviously, during COVID, and then it was kind of lingered for a minute, but then it's kind of lost favor. We've always offered it. It's never not been offered. So happy to do it.
Yeah, okay, brilliant. Okay, let's wrap up with this. What are some real world improvements that you have seen in children when families they embrace a more holistic lifestyle, or the 5 pillars that we talked about?
Yeah, it's a good story for sure. When I first started and I started offering these sort of options for parents from a non-traditional practice, it really gave them confidence in what we could do. And so once we've established that confidence with our patients and families, and they started following our advice, and the pillars changed over time, and now there's the 5 pillars, since there used to be 3, now there's 5. And and it's like you, I hardly ever see your kids. Your kids are always, they get sick, but you got this. You manage it. You've taken our advice, you've seen it work, so you're confident at home now, and you kind of know the limits of your abilities. I can do up to this point, and then now I got to ask Mike for help, and that's what we're here for. So what have I seen in the community? I've seen children's health overall improve. Because of our presence in Long Beach, other practices are offering similar style of care that we do. We're available for you 24/7. We have same-day sick appointments every day. We have new baby appointments every day, so we're always available for you. We have an app for your phone that you can text us anytime, and we respond to you. And we want you to stay connected with us. We want to be that old school pediatrician that was in the community that we used to do years ago, but using technology to keep connected. So access with text messaging, availability through the patient portal, is significantly reduced our sick visits. And so over time, we've had half the day reserved for sick visits, because they would come every day with, basic complaints, runny nose, cough, fever. And even though our patient population has increased, the number of sick visits has declined, because our patient population are confident to be able to handle the simple things at home. And so we hopefully can instill you with that confidence and that ability to be able to treat things simple. And then as they get complicated or get beyond your ability to sort of like, why is this lasting 10 days? Why is this taking so long? We're here for you. We want to be that connection for you. We're also really intent on getting to the root cause. We want to find out why your kid is sick every month for 3 months in a row. We want to know why your kid isn't responding to the sort of simple things that we normally, the healthy choices, the pillars. Why is my kid getting better? Why the pillars aren't working? We're going to find out why. We're going to dig in and take a look. So we offer testing in our office now. So every Thursday we have a laboratory in the office, and so we can test your kids to see if there's something there. We have access to one of the best hospitals on the planet, Children's Hospital Los Angeles. We're affiliated with them. And so we really have the best pediatricians in the world in our back pockets on our cell phones. And so if there's a problem that Mike and Growing Healthy can't figure out, we're going to reach out to our resource out at Children's LA and get that problem solved. So overall, we feel like we've improved health in Long Beach among children. We've empowered parents to be able to feel comfortable taking care of their children, their kids at home, and hopefully overall reduced the amount of stress and anxiety you're having about your children's overall health.
Yeah, I mean, I can't thank you enough for Mike and his team. And over the years, your team changed, right? But there were there were some core people like Janine who came back, and then yourself, and then Nancy. And even for myself and my family, like before, I used to come to Mike pretty often, because one of the kids always gets sick. But over the years, with the tools and techniques, from the essential oils, the garlic oil, to the zinc, to the psyllium, to the juice plus, to the Vicks vapor, like I've become a little bit more settled and a little bit more smarter in taking care of my kids' health and my health. And my kids, I've seen over the years, my kids are getting healthier and healthier. They do get sick because they're not susceptible to things, but it's milder and shorter. So, and then, like myself, like the other day, Rehan was like, he was complaining about things. He had a fever. I'm like, okay, I've done all these things. And then, okay, it's to a point, I'm like, right, we got to go see Mike now. I mean, we saw Nancy, but, we saw Nancy, which is great. But it just helps. Somehow, as soon as after the visit, Rehan gets better, right?
I get better, right? I'll take full credit. It's just being in my office, you get better.
You get a lot better and everything, but it's just
That's great.
The availability of, I can message you, and then I can also reach out to you or call you, and it just like feels being taken care of. And Mike doesn't just take care of my kids, but myself and my husband. Has it become like a family based holistic practitioner, right, Mike?
little bit of a secret, yes, but we take care of the parents of our children. So if your child is a patient at Growing Healthy Together, then we're able to see you. I have two family nurse practitioners in the office, Jeannie and Nancy, as you mentioned. I train them both. They're both excellent. We all have the same sort of idea and philosophy of care. There's personality differences between the two of us. I always like to remind everybody that Nancy is older than me because she is by 5 months. And Jeannie is amazing. I mean, you've met Jeannie. She was my office manager years ago. She went off to school, finished her degree, came back. She's the perfect fit for us. We're at a really good core group of people right now, and I don't see us changing anytime soon. We have a very good complement of patients, and we're very happy with our situation. And so we're here to stay. We're going to be part of Long Beach forever.
Yeah, I mean, that's exciting. I think the families need you because, it's not just one kid, right? I have like 3 kids, and then myself and my husband and then other people that we've, talked about, because like what you offer, holistic pediatrician, like when I came to you about 8-9 years ago, it was hard because a lot of the doctors are traditionally follow the traditional method, but I wanted something different, and that I know like there's got to be something else. So the families, really need you. I'm glad that they goes your retirement plan, Mike, to have Zoom.
That is a retirement for Mike.
Unless you find like a mini Mike that can, help you.
No, I got a kid going to college. I got to pay for that somehow, so I'm working forever.
Oh, Mike's kid also at one point, Joseph, worked at the clinic.
Yeah, he was office manager. Yeah, he was there for about a year. Yeah, he's doing good. He's moving on now. He's going to get into airplane mechanics. Yeah.
Oh, that's exciting.
Yeah, very exciting.
So let's wrap up with this kind of like this message or this biggest advice. Kids can grow healthy together. I mean, your kids will grow healthy when, so fill in the blanks. Your kids will grow healthy when
they have parents who are confident and an ability to care for them whenever they need them. And then we're instilling that confidence in your kids as well, so they can function as independent humans when they grow up.
Okay, brilliant. Thank you so much, Mike, for joining us. I did tell Mike it's going to be like 15-20 minutes, but it's been longer than that because this conversation has been so valuable and very, very timely. But it is also something that's going to be timeless because there's always going to be the next flu season and everything. But this message is going to be timeless and resonate with so many people, no matter what time of the year. So, Mike, thank you so much for being with me today. Mike is from Growing Healthy Together. So you can check out, scan the QR code or go to ghtkids.com. ghtkids.com, and you're more than welcome to give them a call to arrange an appointment or to come for a consultation. Like Mike said, he does offer telemedicine, but at the moment it's not the most popular thing because people just want to go in person more than anything else now. Okay, Mike, so let's wrap up with your biggest advice, the one thing that you can leave the parents.
Yeah, so I think stay off the internet. Don't use tablets around the kids. Try to do, if you're going to do TV time, make sure it's supervised. Enjoy life in the real world. So if you're spending all your time on your phone or on your tablet or watching TV, you don't get to experience the real world. We want kids to get out and about, experience real world, interact with people, to be normal human beings. And our goal is to get away from where we've been and get back to where we were and getting out and about and enjoying the environment. So that's my advice to you.
Brilliant. Thank you so much, Mike, for joining us today with me on the It Takes Courage TV show. This is your host, Dr. Izdihar Jamil, and it takes courage when you have the confidence to be the parents that encourage active living for your kids. It's not always the easiest, but thank you, Mike, and we'll see you in the next episode. All right, Mike, say goodbye to everybody.
Bye now.